host, Delicia Davis. In today's segment on the journey toward eradicating health disparities, we'll begin with the overview of the Health and Human Services Action Plan, also known as the HHS. Let's dive right in. Due to the racial and ethnic health disparities worldwide, the HHS has an action plan to reduce those issues. The HHS has developed a 5-goal plan. Their vision is a nation free of health disparities and health care. Goal 1 is to transform health care. Goal 2 is to strengthen the nation's health and human services, infrastructure, and workforce. Goal 3 is to advance the health, safety, and well-being of the American people. Goal 4 is to advance scientific knowledge and innovation. Lastly, Goal 5 is to increase efficiency, transparency, and accountability. I will briefly touch on the strategy of the 5 goals. The strategy of Goal 1 is to reduce disparities in health insurance coverage and access to care. To do this, ensuring the individuals who are uninsured must be step 1, and mostly improving care for everyone. Goal 2 must begin with notifying the shortage of primary care physicians, nurses, and health workers. The actions that must justify this goal is increasing the diversity of healthcare and public health workforces, and require healthcare providers to have interpreters to overcome language barriers, as well as promoting the use of community health workers to provide education to their community. The actions that follow reducing disparities in Goal 3 include creating environments to promote healthy behavior and preventing and controlling chronic diseases. To do this effectively, the community must be strengthened to reduce those high-risk behaviors. The strategies backing up Goal 4 involve the conduction and support of research to inform reduction initiatives by increasing access to information, tools, and resources that are needed to conduct collaborative health disparities research. Lastly, I leave you with the strategy for Goal 5, which consists of the promotion of better collaboration and obtaining a streamlined grant for health disparities funding in the efforts of improving the efficiency of HHS by addressing the racial and ethnic health disparities seen on a daily basis. It's just in. I will now turn over the floor to Brian Sum16 as he discusses the effects of the Affordable Care Act on health disparities. Brian?
Alright, thank you, Ms. Davis. Hello everybody, how you guys doing? What a time it is to be alive, Sum16. The Affordable Care Act advances efforts to reduce health and healthcare disparities and to improve health and healthcare for vulnerable populations. These provisions affect multiple dimensions of health and healthcare, including health coverage, access to care, delivery system reforms, provider, supply and capacity, and public health and prevention efforts. In addition, the ACA increases federal priorities to address disparities by elevating the National Center for Minority Health and Healthcare Disparities to an institute within the National Institutes of Health, and creating offices of minority health within key HHS agencies to coordinate disparity reduction efforts. Health coverage expansions that will significantly increase coverage options for low and moderate income families and reduce the number of uninsured are a major component of the ACA. The ACA establishes a new continuum of coverage options that include an expression of Medicaid to a national eligibility. These expansions will help reduce wide variations in access to health coverage across states and significantly increase availability of coverage for low-income families. These expansions are particularly significant for people of color who make up a disproportionate share of the uninsured. Roughly 60% of non-elderly uninsured blacks, Hispanics, American Indians, and Alaskan Natives have income below the Medicaid expansion limit. The ACA provides provisions that include increased access to providers, promote workforce diversity and cultural competence, strengthen data collection and research efforts, and expand prevention and public health efforts. For example, the ACA expands funding for community health centers, which are an important source of coverage for low-income families, and temporarily increases Medicaid payments for primary care services. The ACA strengthens data collection and research efforts by requiring all federally funded health programs and population surveys to collect and report data on race, ethnicity, primary language, and supporting number of disparities research efforts. Lastly, the ACA includes a wide array of prevention and public health initiatives, including a national oral health education campaign with an emphasis on racial and ethnic disparities. Back to you, Ms. Davis.
Thanks, Brian. Our next segment will withhold the Zubik versus Burwell issues, access, cost, and quality, as well as cultural competence and cultural humility.
I am Evan Calhoun, and I'll be coming to you live with ways how the high-profile case of Zubik versus Burwell relate to health disparities. There is no single plaintiff in this case. Instead, the court is considering 7 related cases, which is fairly common. The lead plaintiff in the group, Bishop David A. Zubik of the Roman Catholic Diocese based in Philadelphia, Pennsylvania. Sylvia Burwell is the Secretary of the U.S. Health and Human Services, is a defendant in the case. So basically, the U.S. government is being sued. In this case, the differences or gaps in quality of health and health care come because of the plaintiff's argument that they should not have to fill out forms because doing so makes them complicit in providing women with contraception, which goes against their beliefs. So in this case, if Burwell wins, the companies with strong religious beliefs will be forced to pay contraceptives for their employees and may continue to fight against paying for contraceptives. If Zubik wins, this will affect civil rights by way of religious veto. The consequences will not involve just birth control, but gay rights and racial discrimination. This will affect the health of millions of women by creating health disparities.
Hi, my name is Felicia Crary, and on this journey, we'll be discussing cultural competency and cultural humility. Cultural competency is having an awareness of one's own cultural identity and views about differences and the ability to learn and build on varying cultures and community norms. Cultural humility is the ability to preserve an interpersonal stance, attitude that is other-oriented in association with cultural identity that are most significant to that individual. Cultural competency and cultural humility are similar to each other. Promoting cultural competency is a vital and complicated process requiring continuous self-assessment and constant growth of one's own cultural knowledge. Cultural competency has gained attention from healthcare policymakers, providers, insurers, and educators on strategies to improve quality and eliminate racial disparities in the healthcare field.
I am Bernie Dorset, and I will be discussing the relationship between the iron triangle and healthcare disparities. Let's say you're a low-income Hispanic man with health problems. There is a clinic near where you live that is affordable, but the quality of care is seriously lacking. You find that the closest facility that can effectively assist your needs is 2 hours away and doesn't take your insurance. You have to make a decision. Which of these options is the lesser of 2 evils? Millions of Americans, mostly low-income minorities, have to make this decision every day. As Ms. Davis stated earlier, the first step towards abolishing health disparities in America is to transform healthcare. Improving the access of healthcare, the cost, and the quality in which people receive it is the key to achieving that first goal. However, doing so will be difficult. It has been shown that when trying to improve in 1 or 2 of these aspects, it is in consequence of the third. If there is an improvement in access and cost, the quality of care is known to go down. If the quality and cost improve, the access to it becomes compromised. Until we can find a solution that equally improves on all 3 parts of healthcare's iron triangle, Americans, especially those who are part or connected to these health disparities, will have to continue to settle for the lesser of 2 evils. This afternoon's segment has uncovered a lot of valuable information. As a recap, the HHS has implemented a 5-step goal plan to reduce racial and ethnic health disparities by strengthening, transforming, and advancing healthcare, and also aiming towards technology advancements as well as increasing efficiency and accountability. Due to the ACA expanding health coverage, low and moderate households income households have more coverage options, which helps to reduce wide variations in access, which increases quality care and lowering costs of services. While the ruling of Zubik and Burwell is still pending due to the absence of the ninth justice, it is undeniable that whatever is to come will have a great impact on the religious freedom as well as women's rights to vital preventive care. And last but not least, cultural competence. By implementing cultural competence into the healthcare sector, race and ethical disparities will be a thing of the past.
Thank you for joining us on our journey to eradicating health disparities. See you next time.